everyone, my name is Jorcelyn Shendy and I Kilau, BMIO25098636. So for today's presentation, I'm going to talk about thyroid imaging TC-99M Pertechnetate. So this is the content from my presentation. The first part, we are going to talk about the introduction. The second part, anatomy and physiology of thyroid. And the third part is the radiopharmaceutical use, which is the TC-99M Pertechnetate. The fourth one is patient preparation and imaging procedure. The fifth part, normal versus abnormal appearance. The second last part is advantages and limitation. And the last one is conclusion. Thyroid scintigraphy is a nuclear imaging technique to evaluate the function and structure of the organ. TC-99M Pertechnetate is commonly used radiopharmaceutical as it is widely available, low radiation dose, and produce good quality of image. And it is also enabled to clear differentiation between conditions such as graft disease, autonomous functional nodules, toxic multinodular goiter, and thyroiditis, making it as an essential tool in nuclear medicine practice. So the next part, we are going through the anatomy and physiology of the thyroid. Thyroid organ is located in the anterior neck, consists of two lobes, left and right, connected by a central isthmus anteriorly, and produces a butterfly-shaped appearance. So next, we are going to talk about the radiopharmaceutical use in the thyroid scan, which is the TC-99M Pertechnetate. The physical properties, half-life of the TC-99M is 6 hours, and gamma energy produced is only 140 keV, which is ideal for gamma camera, which can produce a good quality of an image. And why TC-99M? Because it is widely available, low radiation dose, and good image quality, and the mechanism of uptake is trapped by thyroid like iodine and not organified. So it will reflect the thyroid trapping function rather than the hormone synthesis. So the next one is patient preparation in the thyroid scan. So patient must avoid any iodine containing substances such as contrast media and any certain medication like amiodarone or thyroid med medication. And we have to remind the patient also about the pregnancy and breastfeeding precautions, and remove any neck jewelry. Next is imaging procedure of the thyroid scan in nuclear medicine. So the route of administration is IV injection, and the dose given depend on the department protocol. And imaging time, images will be taken in between 15 to 30 minutes post injection, and patient must lie down supine with the neck extended, and the views obtained is anterior, RAO or LAO, optional. So next, we are going to discuss about the normal versus abnormal appearance of thyroid scan. So in normal scan, uptake will be symmetrical, uniform tracer distribution, clear visualization of both lobes, and there are no background contamination. As we can see, this is the image of the normal appearance of the thyroid. And then the next part, we are going to discuss about the abnormal one. As we can see, I'm only going to show you 3 example. The first one is the thyroid nodules, which is the cold area and the hot area. Hot nodule, which is the hot area, is an increased uptake, which is usually benign. The cold nodule is a decreased uptake, but it is also rarely malignant, so we needs further evaluation. So the second one is the graft disease. Graft disease we will see a pyramidal lobe in the image and a linear or triangular area of the uptake. And the third abnormal appearance is autonomous nodule. It is a single focal area of intense uptake, which is the hot nodule, and the suppression of uptake in the remaining normal thyroid tissue. As we can see the image at the bottom. So next, we are going to look into the advantages versus limitation of the thyroid scan in nuclear imaging. So the advantages is the functional assessment and differentiate nodules and non-invasive procedure. Meanwhile, the limitation, it is very limited anatomic detail compared to any other modalities such as CT scan or MRI scan, and the radiation exposure also, and the availability and cost. So there is the limitation. In conclusion, radionuclide thyroid imaging is a valuable functional imaging modality that evaluates thyroid uptake and hormone activity. It plays an important role in differentiating causes of hyperthyroidism and in characterizing thyroid nodules as hot or cold. However, due to its limited anatomical detail and inability to reliably distinguish benign from malignant lesions, thyroid imaging is best used in conjunction with ultrasound and clinical findings for accurate diagnosis and optimal patient management. That is all for me. Thank you for your attention.